Okay, welcome to chapter 13, which is on social cognition and moral development. So, the chapter starts out with a story of John Gibbs, the author of Moral Development and Reality, who spent a summer at a camp where there was a mildly mentally retarded adult named Edward who was tormented by the campers, and he, looking back, wondered why he never interceded. So, this leads us to the question of social cognition and morality, and how do we develop a sense of morality? All right, so these are some of our learning objectives, and we'll start with social cognition. So to define social cognition, it's basically thinking about the perceptions, thoughts, and emotions, as well as behaviors of yourself and others you're interacting with. So, for example, taking the perspective of others, like the worker Edward. This requires developing what's called a theory of mind. Theory of mind is understanding that people have their own mental states. They have their own desires, they have their own beliefs, and that these mental states guide their behaviors. We rely on theory of mind, something that we sometimes call mind reading skills, to predict and explain why people behave the way they do. So if we can understand people's mental states, their desires, their emotions, then we can understand, as well as predict, why they behave in certain ways. Researchers use something called the false belief task to help assess whether children have developed a theory of mind, whether they have the ability to understand that people have their own unique emotions and feelings and beliefs, or are children still in that egocentric stage where they believe that you think and feel exactly what they're thinking and feeling. So the false belief task basically assesses the understanding that people can have and be influenced by their own, as well as in this test, incorrect beliefs. All right, so this is the test. The false belief test has one child, in this example, Sally, places a marble in a basket. She then leaves the room. The child being tested watches as a second child transfers the first child's marble into the box. The first kid returns, and then she's asked, or the child being tested who's sitting at the table is asked, where is Sally going to look for her marble? All right, so obviously if a false belief, or if a theory of mind has developed, then the false belief task is very easy. Obviously, she's going to look in the basket because that's where she left it. However, if a theory of mind has not developed, then the child is going to assume that the person looking for the marble is going to look in the same place they know the marble is at. So not passing the false belief task means that the child will look in the box, in the wrong, in the box where the marble actually is. Okay, so that means that the child has not passed the false belief task and has not developed a theory of mind yet. So, in infancy, children haven't developed a theory of mind. So, a kid won't pass the false belief task until they're about 4 years old, although the theory really begins to develop in the first 2 years. Okay, we talked about that. In the false belief task, children are asked to respond to the following scenario. Girl named Sally puts her marble in her basket and leaves the room. While she's gone, Anne moves the marble to the box. When Sally returns, where will she look? Okay. So we know that the theory of mind begins to develop early. It's based on certain earlier skills, certain abilities. For instance, the infant's ability to have joint attention, which really begins to develop at about 9 months old. Infants begin to look at objects being looked at by their caregivers. They point to it to get their caregiver to also look at the object. And so this is the first development of the theory of mind, the idea that this other person sees things, feels things, believes things differently than I do. In the first months of life, infants are really coming to understand that people have their own intentions, their own set of goals, their own ways of achieving them. Between 1 and 2 years old, pretend play in infancy begins. We have imitation of other people during these first years of life. And this is all very much sort of beginning an understanding that there's a difference between what I believe and what somebody else believes, between reality and pretend, which is also necessary for being able to pass a false belief test. Imitation is very important because it reflects an ability to have a mental or symbolic representation of their actions, the goals, intentions of other people. They understand that other people are different than they are, they behave differently, they feel differently. Comforting a playmate also provides evidence of emotional understanding. So as children develop that ability to comfort others, it shows that they're understanding that other people have their own emotions, and also that these emotions can be influenced. Okay, there is some evidence for the ability to solve the false belief task as young as 15 months old. So children sometimes show that they're surprised when an actor looks in the wrong box in order to find a toy. And we often underestimate what children understand. They know more about the world than we give them credit for understanding. All right, so one theory is that children develop the theory of mind in 2 phases. By age 2, children begin to ask others why, which drives parents crazy. This reflects an understanding of the concept of desires, what we call desire psychology. In which children explain their behavior and that of others in terms of wants or desires. So why do people do this? Why is this happening the way it's happening? They're only asking why because they understand that people have motivations. By age 2.5, children begin to attempt to deceive each other, or adults. They do deliberate deception. They plant false beliefs in others. They lie. Lying is actually a sign of normal child development, believe it or not. By age 2, children also begin to talk about their own wants and desires, as well as trying to understand others. For example, an 18-month-old would express happiness at goldfish crackers and disgust at broccoli. Okay, so they know that they have their own wants and desires. Belief desire psychology is shown by age 4. This is that children begin to pass along false ideas. They attempt to fulfill their own desires. So they understand that people do what they do because they desire certain things. So what we see at age 2, where we have desire psychology, where children are starting to understand that they have their own wants and needs and other people have their own wants and needs, that's fully developed by age 4, which is when it becomes belief desire psychology. 4-year-olds, they understand that beliefs don't always reflect reality. They also begin to appreciate what others do because they desire things and they believe that certain actions will help fulfill those desires. So they're really paying attention to how other people are acting. And they they really begin to understand that manipulating others helps them to fulfill their own desires. So we get even better lying by 4 years old. So you all remember Piaget. We talked about him, and Piaget believed that 4-year-olds were very egocentric beings. They did not have a good understanding of other people, but the research actually shows that 4-year-olds are pretty sophisticated in understanding other people's motivations, desires, as well as how to manipulate that motivation and desire in order to get what they want. Now, one interesting thing is how theory of mind plays into children with autism and other disorders. Autistic kids often have normal levels of intelligence, sometimes even higher than normal levels of intelligence, but they usually fail the false belief task. While children with Down syndrome who have significantly lower intelligence levels often fail or pass the false belief task. So autistic children have what psychologists call mind blindness, that their mind is blind to other people's emotions, to other people's beliefs, that other people have their own mind. So they appear to lack theory of mind, which of course makes life much more difficult for them. And you remember when we were talking about mirror neurons and we watched that video, that it appears that autistic children's mirror neurons don't fire like they should, which of course would explain why they don't have theory of mind. All right, so if we look at nature and nurture, as is important in every area of psychology, we need to understand what is biological and what is environmental with developing this ability to have compassion and eventually morality towards other people. Evolutionary theorists find support for nature in the development of theory of mind, as primates like chimps and gorillas and other apes show the capacity to deceive and lie. The theory of mind is also a result of neurological maturation, cognitive advancement. The brain grows. We also see, of course, with autistic children, abnormal brain development that might be responsible for lack of theory of mind. So that's more evidence of biology. Research using a functional MRI machine has shown that the areas of the brain that light up when people are thinking about false beliefs are the prefrontal cortex and then the temporoparietal areas of the brain. And so there is, of course, a brain biological foundation to understanding beliefs of other people. The prefrontal cortex that is active in adults' ability to think about others' beliefs are active in 4 to 6 year olds who are able to pass the false belief task. So this is the area of the brain that is developing, that's growing, that's advancing as children get older, and allows them to understand deception, allows them to understand that other people might have inconsistent beliefs or beliefs that are inconsistent with reality. Of course, I mentioned the mirror neurons, that these are activated when we perform an action and when we observe someone else perform the same action. And these obviously would have to play a large role in empathy and understanding others in the theory of mind. And again, this is very difficult for autistics to do because their mirror neurons don't seem to be functioning like they are supposed to. Now, when we go to nurture and we look at the environmental impact, acquiring a theory of mind requires experience with other human beings. So although there's a biological foundation or a nature foundation to theory of mind, if this child has not been around other people, then they do not develop a theory of mind. So if you look at orphans, or if you look at feral children, they don't develop an appropriate or even any theory of mind. They don't have compassion and understanding for other people, which is often why parents who adopt orphans struggle with their children, because they don't have empathy. If you watch that Child of Rage documentary that I mentioned, it's available on YouTube, then you see the same situation happening, that here is a child who is isolated as well as abused, and they did not develop attachment. They also didn't develop an ability to have compassion for other people's pain. And so inflicting pain on them, even to the point of murder, didn't cause them very much distress. So you have to have social interaction, and interestingly enough, the social interaction needs to involve language of some variety. Sign language is fine. As a matter of fact, deaf children of deaf parents who communicate effectively with their children through sign have children who develop a very appropriate theory of mind exactly on schedule. However, deaf children of hearing parents who don't converse in sign language show delays in their ability to perform the false belief task, often until even 8-10 years old, which is not something that's desirable for developing empathy and morality in your child. So parental sensitivity is very important. Have to be sensitive to their needs, their perspectives. Of course, you want the child to develop a secure attachment. There's something called parental mindedness, which is where parents talk to children about their mental states and help to elaborate on what the child is feeling. So this is like the example of where the parent is following the child around the playground and saying, "This is what you're doing. You're walking up the slide. You're going down the slide. That must have been so much fun," or "You must be feeling bored right now." In another situation, that is a very important thing for parents to do. But again, it needs to be done in moderation. Excessive amount of elaborating on how the child is feeling can be very invasive, and that's not sensitive parenting. Cultures where children don't experience talking about their thoughts and beliefs will show delayed acquisition of the theory of mind. So culture, which is of course nurture, plays an important role in helping a child to develop a theory of mind. Okay, so acquiring a theory of mind is really the foundation for all future development of the mind in relationship or social cognitive skills. It begins in infancy, continues through toddlerhood, and it's really a combination of nature and nurture, that the mind is developing, neurons are connecting, but of course, experience in real life, social interaction helps to develop that, helps to stimulate those neurons to connect so that the mind works appropriately. Otherwise, it's delayed or possibly doesn't happen at all. Now, this is really important for children to develop a theory of mind. There's consequences for both developing and not developing it. Children who have mastered theory of mind tend to do much better socially. They're much more socially adjusted. They're able to understand people's emotions better. They have what we call high emotional intelligence, which of course, as you know from the intelligence chapter, leads to all sorts of benefits in society. They're also able to think more maturely about morality. So they develop stronger morals. They're able to think through moral questions better. They don't have to rely on their parents or other adults to make good decisions. So theory of mind is very important. Can also be used for inappropriate purposes, which is kind of interesting. Bullies and good liars, con artists, they often prove to be really good at this mind reading, this theory of mind. They understand what other people are thinking, and they use that to manipulate them.